Good morning, everyone. We're going to go ahead and get started, and I'd like to welcome you to the Second Chance Employment and Reentry session. So if you aren't supposed to be here, you still have time to find where you're supposed to be, okay? I'm Nancy Hale, President and CEO of Operation Unite, and I will be serving as moderator for the session, which is quite an honor for me because these folks who are your panelists are distinguished, they are experienced, they're passionate. I've known them. I've met Seth today, but he's a legend for us with all of the work that he does for our counties and everything. But bottom line, everything that these people do is to save lives. That's what they have in mind. And they're passionate about their work, and they're passionate about helping people who are in recovery complete that recovery and remain that way by finding work and the integrity that goes with that. So it's an honor for me to be here. I'll introduce them, and they'll be sharing more about themselves in just a few minutes. Tim Robinson will be going straight down the row here. Tim Robinson is the CEO and founder of Addiction Recovery Care. Miss Morgan Kirk is the director for the next 2 weeks of the Workforce Recovery Program with the Kentucky Chamber. Jeff Whitehead is the executive director of Eastern Kentucky Concentrated Employment Program. And then Seth Long, the executive director of HOMES, which is an acronym for Housing Oriented Ministries Established for Service Incorporated. And before we get started, on behalf of SOAR, I'd like to thank the following focus session sponsors for making today's program possible. And if you're able to get to any of their booths, please thank them personally. The Kentucky League of Cities, the Kentucky Association of Counties, the Kentucky Chamber of Commerce, Kentucky Small Business Development Center, Kinetic from Windstream, Connect Humanity, Eastern Telephone and Technologies, King's Daughter Medical Center, in Indiana, Kentucky, Ohio Regional Council of Carpenters, the Foundation for a Healthy Kentucky. Operation Unite is a small nonprofit in southeastern Kentucky, primarily in the 5th Congressional District. We were launched nearly 20 years ago on April 7th, 2003 by Congressman Hal Rogers in response to a special report, thank you Lexington Herald Leader, known as Prescription for Pain, that ran in the Herald Leader in January and February of 2003. Those newspaper articles exposed the addiction and the corruption associated with both licit and illicit drug use in southeastern Kentucky and other parts of the state, but just 2 or 3 other counties. You can read those articles at our website, operationunite.org. And the reason that I'm bringing that up as we start this morning is it's very important for us to never forget what brought us here today. We don't want that history to repeat itself, but we need to look back and remember what brought us here and the progress that we've made, and knowing that our work is never done. Kentucky's doing great things, and you're going to hear that from each of these panelists today. Operation Unite is very proud to work alongside partners such as these gentlemen and Morgan that you see here in the treatment and recovery ecosystem. They're leading the way when it comes to employment, and we know that employment plays a critical role in long-term recovery. Kentucky has taken a leading role in bringing this to fruition. And so today we're excited to hear more from these panelists about their efforts and initiatives that encourage second chance employment and reentry into the workforce. And so Tim, we're going to start with you this morning, and then we'll have some questions if you have questions as we go along today.
Well, I'm so happy to be up here with so many of my friends. We're not just colleagues, but we've all built friendships over the years, and some of my favorite people are on this stage today. And Nancy talked a little bit about success that's happened, and we hear a lot about the hopelessness out there when it comes to addiction. But pre-COVID, you're sitting in the congressional district that had the biggest progress in the United States in cutting overdose deaths. In fact, the University of Chicago's Nork Center for Public Policy looked at every county in the United States and found out that 14 of the top 20 counties in the country were in the 5th Congressional District here in East Kentucky. And better than that, 8 out of the top 10 were here. And that compared a 5-year period between 08 and 2012 and 2013 and 2017. And this was at the same time that opioid deaths increased nationally. And if you look at other states that connected to us, especially Ohio and West Virginia, their increases in overdose deaths skyrocketed during that time. And we've got communities here that have done just tremendous work. One is Letcher County, county next door here. In during this last period of time, in the last 4 years, they've cut their opioid prescriptions per 1,000 people by 70% in Letcher County. And so a lot of the work that the folks on this stage has done has led to that. And a big part of that is that we really have built recovery ecosystems in East Kentucky that, yes, we have access to treatment, and that's important. Yes, we have fought for recovery and recovery resources, but we've taken it a step farther when it comes to second chance employment and realizing, and I'm going to steal Jeff's quote before he can use it, that a good job is good medicine. And we have built national models here in the mountains when it comes to second chance employment. And so you asked me why does this matter? Why are we putting so much attention on this? You know, the first answer to that is of course that people in recovery are some of the most productive people that you could ever hire. In fact, Deloitte Consulting studied it, and somebody in addiction that's in active recovery, miss less work than somebody who's not. And so that's very important in terms in the outcomes we've seen. But here's a number you should know. If you're here and you don't understand what addiction has to do with workforce, right now we're at a 40-year low in workforce participation nationally. Some of that's baby boomer retirement, but that's not a large portion. And Ohio State Swank Centers looked at this. The Brookings Institute has looked at this. And right now, the big gap in our workforce is prime-age men 25 to 55. We've never had a time in recorded history other than a depression when more 25 to 55-year-old men prime age are not working. And here's what the research showed, is that of that group that's not in the workforce, half of them take pain meds every day. And of that half, a third of those had no prescriptions, which means that they're using illicit drugs. So it's pretty clear where the workforce problem is, and then that should point us toward the solution. My good friend Mike Cottle got here after I bragged on Letcher County and the work that they're doing down there because of partners like MCHC. Because here in Eastern Kentucky, we have an entire consortium of people that have come together on this issue. So let me just real quickly go through. We're ARC, we're Addiction Recovery Care. We're based in the big town of Louisa, Kentucky. And if you look at the map, you'll see that a lot of the work we've done is building resources here in the mountains in Eastern Kentucky. It's where most of our network. We do all levels of care, detox, residential, PHP, IOP, outpatient levels of care. But we've not just stopped there. We've not stopped at just doing addiction treatment. We say that we have a crisis to career model where we, yes, get you treatment, but then we move you into recovery, then we put you into vocational rehabilitation, and then move you into one of our job training programs. One of the things that we've found over the years is that people who have a economic opportunity stay in recovery, and the ones that don't tend to relapse. So some of the things we've done, besides hiring a third of our own workforce are former graduates. We have about 900 to 1,000 employees. A third of them are graduates of our program. About half of our employees are in recovery. But we've also started some enterprises like Second Chance Auto, where we train certified mechanics, and Second Chance Lawn and Property Service that's getting ready to add a landscaping certificate. And one of the big projects that we're doing right now is down in Washington County with Toyota Tommy, who is they're a subsidiary of Toyota. And when we opened Crown Recovery Center, they were down 65 employees that they couldn't fill, and they were actually bringing workers from Japan to fill jobs because they couldn't get enough employees. So I think I just heard that they've hired their 22nd Crown graduate, and they're getting a start at $18 to $20 an hour. If they're there for a short amount of time and build a resume, they can go on and join the auto manufacturing. They could go to Maine Toyota and really make a $75,000 type wage starting out. And so we're showing that community's workforce problem, one of the solutions is second chance employment. And they've actually even been through the Kentucky Chamber's Fair Chance Academy, where they train people on how to hire people in recovery. And I'll stop right there because that's my slides. But I would just like to say that this work is very important, because not only is workforce participation holding back our economy, but if we don't have a comprehensive solution to the addiction crisis, we're not going to come out of it. Now, I said if we don't have, that's not going to be an option because of organizations like on this stage. We did a 50-year anniversary event on the war on poverty in my hometown of Inez. Is where Lyndon Johnson came and kicked off the war on poverty. And one of the things we did at the 50th anniversary is said these next 50 years, it's going to be people here that birth solutions. And we may be ground zero of the national opioid epidemic, but this is ground zero of the national solutions. And we're developing the solutions and we're exporting them across this country. There's people coming and seeing what we're doing. And these folks on this stage are not just changing Eastern Kentucky, but they're changing our nation.
So Morgan, you're next.
Thank you. Can you all hear me? Is it working? Perfect. Thank you so much for that, Tim. And I think it's really important when we talk about this, you talk about this being the epicenter on the opioid epidemic, but also understanding this is where the solutions are coming from. And that's what's so important about being here at SOAR today, that everyone is learning about these issues, but how we can be part of that solution too. And that's really what brought me to the chamber when I came in the beginning, is seeing how do we work with businesses to hire individuals who are in recovery or who are a part of that justice system. And so I'm so proud of the work that we've been doing with the Kentucky Chamber and with the partners on this stage to really move this work forward. And I wanted to be able to share this slide around industry alignments for us, just to show where we are looking at our priorities for the year, working with businesses who are in healthcare, within the construction industry, ag, equine, and in manufacturing. And that's not to say we aren't also focusing on other industries, but that's where the priority is based on some of the data that we have seen come out. And that's where the Kentucky Chamber is focused in my line of work with the Workforce Recovery Program, to train businesses and help educate them on how to intentionally do this work. And so for us, looking at focusing with those industries really comes from the Kentucky Transformational Employment Program that we launched in 2021. And this came about because in 2020, there was a Senate bill that came on the floor, Senate Bill 191. And they wrote it into law to be KRS 222.215. I have to have that or I'll never remember it. But it's essentially a way for businesses to have protection, legal liability protection for any civil action alleging negligent hiring or retention practices. Because we know it's very important to tap into that untapped talent pool of folks in recovery, but businesses have often had a fear about liability related to that. And that's where this law came into play, so that businesses would feel that protection and be able to hire folks who are in recovery. And launching that in September of 2021, we now have, this is a bit outdated, we have 100 businesses now with more than 20,000 employees between them who are actively part of KTEP, that Kentucky Transformational Employment Program. And really it's built as a way for employers to be able to make connection to qualified treatment providers if their employees are in need. Because so often if they have a drug screen that they've tested positive on with that zero tolerance policy, they're fired, they're let go. This gives the business an opportunity to help them along the way, to get connected to a treatment provider, to pause employment until they can then test negative and come back to employment. And so with launching that last year in September, we have asked for annual data. We'll be getting back now to see how this has assisted employees to be able to stay with their employer. And the reason for the industry alignment that you saw really goes to the numbers and the data through KTEP, that 2 of our top industries are in manufacturing and healthcare. So we know there's a lot of interest in those industries to hire folks who are part of fair chance populations. Where we have our lowest numbers are in construction and hospitality. And we know those are the 2 industries, when we look at data, that have the highest overdose death rates. And that's why we want to focus within construction to figure out how we can help businesses to talk about this more openly, hire folks who are in recovery, and help them keep on the path to recovery. We also have training and education that we provide, one being an employer resource guide on our Kentucky Comeback website. We also come out and do stigma training for businesses to be able to help everyone from the CEO down to folks who are working in the field who will be peers to understand how to reduce stigma around talking about recovery. And as Tim mentioned, we just launched our first Fair Chance Academy in May of this year. We graduated 20 business leaders from that academy, where they spent 3 days with us in Frankfurt, deep diving into the disease model of addiction. They did a reentry simulation with the Department of Corrections to understand those social determinant of health barriers to individuals who are coming out of where they've been. Maybe it's transitional housing and recovery with the justice system, to understand the barriers that they face. And they have about 30,000 employees between them who can be impacted by this work. And we're already seeing a success, as Tim talked about with Toyotomi, and seeing them be able to hire folks on full-time and part-time because they now feel they have a better understanding of what it's like to be able to hire folks who are in recovery. And we are so thankful, particularly for Brandon Wilson at ARC, who has gone out with us to help tour recovery centers, go into jail systems, and bring employers in so they can put a face to what they have stigmatized for so long. They're really getting to know the people, they're knowing the program, they're understanding, as you talked about, the retention rates are higher, they're showing up more often because they've got an amazing support system in folks like ARC to be able to do that work. And they also have great support in folks like EKCEP through their site initiative. And I know Jeff's going to talk about that now. And we just so appreciate the partnerships that we've made to make this work move forward.
Morgan.
Yeah, she did good. And we just happened, I think we just sat in the right order too.
Well, we took care of that before you got back up here, Jeff.
Okay,
Yes.
Okay, all right.
So.
I just came and sat down. There was only one seat. Okay, I get it. All right. Thanks for taking care of us. All right. It is an honor to be here and to be on stage with these folks. I love what Tim said about how we're building an ecosystem. And that, I think, is an ecosystem that's continually under construction. But being a part of Recon and all the conversations that are going on, I'm struck by the fact that we have done a really good job of sticking together, not being territorial. We've come together as friends and partners, but I think that is something that we really need to nurture and continue to build this ecosystem, because it takes everybody. It takes all different kinds of partners and agencies, folks that are in treatment, the business community. It takes all of us to move the needle. And so I guess I'm gonna start with just kind of talking about some numbers around our site initiative with EKCEP. But then I want to get back to kind of where the roots of that started, because I think that's important. But SITE stands for Strategic Initiative for Transformational Employment. We are providing, basically, we're working to build a bridge between people in recovery and coming out of treatment into employment, and making sure that that is a transition that isn't, you just don't cut people loose, that there's maintaining that connection with that ecosystem, right, and the treatment that is provided, and that network of support, and then into employment. And working to, some of the things that we do, is working with people to help deal with some of the non-work related kinds of things that people in recovery have to deal with. I've got to go to court. I've got things to do with taking care of my children, or I'm getting my children back. Transportation, housing, all different kinds of issues that we're there, the site folks, through our job entry and retention specialists and success coaches, are there to help them navigate. So that's kind of what we do. We work with career planning, resume development, but I think that the long and short of it is really to build that bridge and help people navigate some of those challenges as they enter the workplace. So let me remember to. So those are kind of the positions, the job entry retention specialists, and I wanted to mention a little bit about the Employer Resource Network, and that's where a lot of our success coaching. We've come to realize that a lot of work that we have to do is helping people retain employment once they get employment, but how do you thrive and grow in that job? And that's a partnership with the employer and the people. And we have, throughout the state, this is a statewide program, we have connected with employers that are paying for a share of the success coach to be available to their employees. So that is employers putting skin in the game, paying for and seeing the value enough to pay for having these success coaches available to them. So that's something that's growing across the state, and I'm really thrilled to see that happen. Just real quick, we've been doing this. We're in our third year of doing the SITE program. So far, we've connected with 7,105 individuals in recovery. We've knocked on the doors of 3,200, almost 3,300 employers, and we have 796 employers, partners that have hired individuals that we've placed, and that so far is right at close to 1,700 people that we've gotten into employment. So that's kind of where we are today. Probably tell me if I didn't practice this, so if I'm over time, just holler at me. But this kind of started with an introduction that Jared Arnett back there in the back made with me and Tim, and said, you need to talk to Tim Robinson. Do you know Tim Robinson? No, I don't know Tim Robinson. Well, this was back a few years ago. And we met, and we sat at in a Mexican restaurant and talked about and Tim talked to me about how important good employment was to long-term recovery, that it was the second highest data point or connection to individuals maintaining recovery. Beyond, the first was long-term residential care, and the second was employment. So we kind of mapped out this idea of how do we help people become peer support specialists and move them from having a problem to being part of the solution, because who else can better understand the path that has to be taken to be in recovery with somebody who's walked that path. And we started doing that. And, you know, never underestimate the power of doing one small thing, because it's where we started. Does this just help these folks do this thing? And it was all about partnership, but full circle, over and over and over again. The one thing that I know is that as I'm in the region talking with people about whatever it might be in workforce, I'm constantly being confronted with this individual who is like a rock star, who is vibrant, who is committed, passionate about their work. And I'm saying, man, this person is on fire. We need more people like this for sure in the workforce. And over and over and over again, I find out that's an individual who's in recovery. That's an individual who went through a treatment and who's on the other side, over and over and over again. So when Tim talks about the workforce participation rate being low in the nation, we're one of the lowest. And if we're ever going to come out of it, we need people in recovery who can be that kind of vibrant employee and leader and entrepreneur. They belong to all those categories. I've met them, and you know, it's where we need to be paying a lot of attention, because like Tim and Nancy said, we're saving lives, but we're also saving our region by doing it. So,
Thank you.
Yep.
Thank you. And Seth, you know, I've tried to apologize just because he's sitting on the end, but he said if you're looking at this way, he's really first. So, Seth, why don't you share with us now?
Yeah, so my name is Seth with Homes Incorporated. We are a 501c3 nonprofit based in Letcher County, and we serve Letcher and the surrounding counties, including Wise and Dickinson County in Virginia. Our main thrust over the years has been working with housing, affordable housing solutions in the way of building and developing new homes, doing many repair jobs on homes that people already own. We have built up over the years rental housing portfolio. And more recently, we started a line of business, a social enterprise around solar installation on businesses and housing. And we also have done quite a bit of work in our community doing community projects. If anybody's ever been to Letcher County, they've probably seen the Pine Mountain overlooks. We worked closely with tourism on those type of projects, covered bridge in town and different things, trying to make Letcher County a better place to live. And really that idea of making Letcher County a better place to live was one of our motives for developing a partnership way back with Addiction Recovery Care. Pre-COVID 2019, I think we worked on a project together introduced by FAHE to develop some sober living housing in Letcher County, which was kind of, in a way, I think, looking back, putting the cart before the horse, because they did not have a presence in Letcher County yet, but there was a great need for sober living housing in our community. So we started working with them then. But as we began to talk, and every time I have a conversation with Tim, I'm just hanging on to his coattails, trying to keep up with the vision that he cast in front of us. But the idea was put forward of developing an apprenticeship program with working with guys who have graduated from their intensive recovery program and coming to work homes, because the work that we do involves construction. We build things, we do things with a crew of in-house construction workers. Right now, we currently have 15 guys on the crew who do the work that we do all across our region. But what we've been able to do over the years since this partnership has developed is bring on up to 4 men at a time into an apprenticeship program. When we first started doing that, we had a term of 8 months. We'd work these guys for 8 months. But I quickly came to the point of thinking 8 months is not enough. We need more time, because at 6 months, they need to start looking for a job so that they can transition into something else. So we went to a year from there. So we were doing year apprenticeships, but I was like, it's not enough time. There's something magic about being able to put on a resume, I've worked somewhere for a year, 12 months. So we are now in our apprenticeship program working these guys for 18 months. The first 12 months, just out in the field doing what we're doing, whether it be a solar install, whether it be putting a new roof on an old house or framing a new house. They could be doing anything with our guys out there, and then working for us for a year. And one of the big benefits, I think, of working with us in this way is, a lot of these men coming to us, their past are a train wreck. They get into recovery. They want to do better. Now what? So you go right from the recovery process, graduate from intensive care, and then try to get a job out in the world. And I just felt like our place as a 501c3 nonprofit would be a good place for men to land, where we could be maybe perhaps more patient with them and showing grace to them as they work through what it's like to be a part of a real job scenario. And one of the things that was really important to me is keeping the numbers manageable so that they would get a real world taste of what it would be like to be on a construction crew out there. I did not want like 12 guys coming watching one guy work, but where we only have 4 men at a time, they get absorbed into a crew, and we count on them and we treat them like we've hired them into our organization and have the same expectations that we would have for any of the other workers that we have. And in doing that, I think it really helps them for the next step in life, for that next job that they go into. We're really trying to do the best we can to give them that work experience, to hold them accountable, to train them in soft skills, but also they learn a ton of construction trades. It's been mentioned before, being in the construction trades business, it's hard to find people to hire to come and help us do the work that we do. The average age of our crew is probably about 54 right now. We have a guy that's 76 years old that works a couple days a week, and not very many younger people. The guys coming to us through ARC are typically around 38 to 40 years old, and they got a lot of life ahead of them. They're eager to learn, and it's been, for me, as the director of homes, one of the most rewarding things that I've ever done. We built a lot of houses, we fixed a lot of homes for people, but seeing men grow in their desire to want to do better and to be a part of a solution has just really been rewarding to me.
And all of you. We have a few minutes, and we do have some questions from some employers that you all may want to hear how, because there is a lot of questions for the employers. We all understand, we're looking at it from those who are in recovery, their point of view and things. But so just whichever one of you all would like to hop in on this. But what message do you have for employers who want to be part of the solution to the addiction crisis but do not know where to begin?
I think that for employers who are interested, and we've seen this quite a bit, that they go, look, we want to, but we don't know how to start. A great place to start is talking with businesses who are doing this already. Those who have learned some of the lessons along the way, who have implemented some best practices. I don't think there's ever a reason to reinvent the wheel. I think that a business will have differences between them, even within the same industry. The way Homes may do something may be different from another construction company nearby, but it's great to learn from those who are already doing this work and reaching out to the resources that exist. Businesses don't know what they don't know, right? And starting with hearing from panelists like this and the community organizations that are available to help you along the way, you don't have to do it alone. You never have to do it alone. There are so many amazing resources and people to help you. It really does take a village. As cliche as it sounds, it's the truth. And so I think for businesses interested in this, it's reaching out to businesses that you've heard of doing it to say, how did you get started? Who have you talked to? And let them help build that network with you.
And just as a reminder, Morgan, if I were an employer and I'm following up on what you've just suggested, where would I find a business that is offering second chance employment?
That's a great question, and we can certainly help with that, especially with our Fair Chance employers that have gone through to be certified as part of Fair Chance Academy, those who have signed up for the Kentucky Transformational Employment Program. We can help connect you almost like a mentorship program to help you with that.
Another question that we had, and it's been mentioned up here, has to do with stigma, not only stigma of addiction, but a stigma of recovery. There's unfortunately still a lot of stigma around individuals in recovery and recovery in the workplace. All of you have had the opportunity to work with Kentuckians who are in recovery. Can you share some of your personal experiences, and Seth has done part of that, and your observances on how of working with them and reducing that stigma?
Let me just interject in here. And, I was talking about Letcher County earlier, cutting their prescriptions per 1,000 people over the last 4 years by 70%. They did that by doing what you just said, Nancy, is Mike Cottle and Van Breeding at Mountain Comprehensive Health Corporation, the FQHC there in Whitesburg. Matter of fact, we're another introduction that Jared Arnett back there made and brought us together. And they came and toured a recovery center, Karen's Place down in Louisa, and saw what a drug treatment facility was and saw people getting their lives back. And that's one of the big gaps we have in our communities, is that people believe there's no hope, that you can't get somebody out of that. And so they came in and saw hope, and then they literally carried that hope back. And especially Dr. Breeding, who is an evangelist for anything he's passionate about, he becomes an evangelist. And they quickly organized in their community all the different healthcare entities is where they started. And so they brought ARH Health System together, MCHC. They brought the groups together, and they really got focused on bringing the court system to the table. And today, the Letcher County District Judge there, Kevin Mullins, has ordered over 700 people to treatment during these last 3.5 years. For us, per capita, there's been more people come out of Letcher County than they have been out of Fayette County and Jefferson County. And so what's happened there is that, plus all the efforts like, Operation Unite has a strong, they have a strong coalition there. And so between what they've done, what MCHC and organizing the medical community has done by bringing in the court systems, they have reduced stigma there. And the stigma there is it can't live where a recovery ecosystem.
That's right.
Whenever there's a recovery ecosystem, it's like the light that forces out the darkness of stigma. And so that's one of the things I would say is that you can do this on a community level. We've done that in Lawrence County. NORC just came out with a recovery ecosystem mapping tool, and Lawrence County, Kentucky has the #1 recovery ecosystem east of Wyoming. And our score is a 76, where Jefferson County is a 4. And so we can build these recovery ecosystems like in Lawrence County, like in Letcher County. We can build them here. And I think in time what we're going to see, Jeff, is by having a recovery ecosystem, you're going to have a different kind of workforce than what they're going to find in other places. And it's actually going to be an economic development recruiting bonus for us that we have recovery ecosystems with people that are in recovery that can work.
We've just had all kinds of experience where we've placed people with manufacturing or wherever, try this person out, and then, you know, check in on them months later. Well, this person's got a pay increase. Now they're the supervisor. You know, those are stories that get repeated all the time. And I was at a meeting just the other day where somebody out of recovery was one of our clients. They've started their own business in transitional housing and are, you know, doing amazing things. So yeah, I think it is going to change the workforce landscape.
Well, I think that we've landed right at 10:15, exactly where we're supposed to be right now. Do I just need to close it out? And all right, we'll be here. If you all have any other questions or want to talk to us about anything else within our programs, we'd be more than happy to share with you. And just go back home and start thinking about getting that recovery ecosystem developed in your county. And there are a lot of people here who would love to help you with that. Thank you.